And I am not an expert on this either, and recognize that you probably have a better understanding than I do. What is ketamine therapy?
Ketamine therapy it's funny because ketamine gets lumped into the psychedelics as medicine space, and it's really not a classic psychedelic. It doesn't act on the 5-HT2B receptor in your brain. It's a disassociate, but you go into a almost psychedelic type of state while you're disassociated. Ketamine is obviously a remarkably safe drug. It's been used for decades. It's still used today as an anesthetic for child surgeries, things like that, veterinary surgery. So it's a super safe drug. Half-life is super short. But what it does is it allows, if you're going through a very traumatic event in your life, to pause for a second, disassociate from trauma, behavioral issues, things like that, and then come back and have a full, long discussion with your therapist if you've had that chance to have the reset. Dr. Robin Carhart Harris, actually, I think it's the best explanation. Think of a snow globe, right? If you're constantly walking through the same four trails, there's going to be no snow in those trails. Think of ketamine as shaking the snow globe, so now you can create some new trails to walk through. It's a great way to describe what that does to the patients.
That makes a lot of sense. I used to smoke a lot of weed when I was in high school and especially in college. And what the thing that I liked about it was it helped you. I use the analogy of I felt like it would help me pull back from reality almost a little bit. But whereas without it, your face is up against a fishbowl and you're just going at life 100 miles an hour. And that helps you just pull back and gain some perspective.